You're on.
Okay. Well, thanks very much, everyone. I'm Craig Turbot, and I'm a wills and estates lawyer in Calgary, and Deepak's my other presenter here, and he's an expert on sort of health, performance, and longevity. So he's going to speak to that side of things a little bit later in the presentation. So I'm going to start out by talking about a personal directive, which is the document that you have in place that is, like what is a personal directive? What it is a document that you have in place so that if you don't have capacity at some point, if you are unable to make decisions for yourself regarding, various personal matters, and I'll get to that in a second, then it's appointing someone to be in charge of those decisions so they can act on your behalf, which is relatively straightforward a concept. So the person that you appoint in a personal directive is called your agent. And the kinds of things that it covers are anything to do with you personally. So you might have heard of a power of attorney. A power of attorney just covers financial matters and anything related really to like taxes, finances, all that kind of thing. It's a very similar kind of document, but this one is specifically not the financial side. This is everything else. So it's dealing with where you can live, your medical care, who can visit you, types of activities you can be involved in, all that kind of thing. Additional decisions around different maybe employment activities, things you might be learning, all those kinds of things. So it's pretty broad, other than the fact that it doesn't cover financial, taxes, all those kinds of things. But it's sort of the all-encompassing document that allows someone to make a broad range of decisions for you. And so when you're thinking about those decisions, you want someone to be your agent, as we discussed. That person, you want someone who's going to take on that role and not just know what you would want in those circumstances. Obviously, you need someone who is close to you, or at the very least has a very good understanding of what you would want. Even if there's someone you really like, if they don't understand and you've never had a really sort of deep conversation about serious medical concerns you have, not your personal medical issues, but rather if you have a strong feeling about not wanting to be intubated, or if you always want someone to do, medical professionals to do whatever they can to take care of you, in order to maximize your life, even if you're in a coma for 30 years or something like that. That would be something that would be important for that person to know. So you need someone who knows you very well, knows those kinds of details, and is able to act on them as well. Like, yeah, it doesn't have to be the most, to the point type A personality who's going to just get stuff done. But at the same time, you don't want someone who might know what you want, but is going to sort of, I'll make a decision later, we'll get to it. Because it's not just the medical side. Obviously, making a decision when it comes to something medical is important, but usually doctors are good at ushering someone to the point of making a decision if that comes up. It's also in the event that you were to need to be provided with more care in terms of your day-to-day life. So whether it's going to a care home or having in-home care, or some of the other options, you want someone who's really going to make sure that they're supporting you and going to bat for you if they feel like your care level is not being met in a way that it should be. So you really want someone that's going to take the extra effort to make sure, for example, if you're going into a care home, they're going to look at 4 or 5 different care homes and ask all the difficult questions, and just make sure that everything's set up right for you. You don't want the person who's going to say, yeah, I saw them a couple months ago, they seemed fine, end of story. So you really want someone that is going to not just care about you, not just know what you want, but someone who is really going to go the extra mile and make sure that that person, and make sure that you are well taken care of. So along those lines, when you're thinking of this person, the most convenient location for that person is obviously as close to you as possible. Now, that doesn't mean that if you have the right person in another province, COVID restrictions aside, who knows? But generally speaking, if you have the right person and they're in another province, Generally speaking, I still advise that that person is better than the wrong person who's local. If it's a flip of the coin, you're happy with either, then go local, obviously. But at the same time, having the right person is more important generally than having someone who's nearby who doesn't really care or doesn't know enough to make the right decision here. So that's really something to consider. And oftentimes I'll also talk with clients, and they maybe have, oftentimes this is when they have multiple children that they're thinking of naming, and they want to name them all jointly. And this is something where we can name them jointly, but you just need to think about how they all get along. For a lot of the decision-making roles in your estate planning, under your will, under your power of attorney, and your personal directive, most of them I tend to advise people to stay clear of joint decision-making. With a personal directive, sometimes I'm a bit more, it depends on the circumstance. One of the reasons being, if it is a major decision, such as maybe taking you off life support or something like that, if you know that there's one person that will do what you want and what you want is very clear, then that's the one person you should name. But if you have, 2, 3 kids and you want to name them all jointly and you feel like collectively they can come up with a decision, then, that's something that I'm open to discussing with clients, just because when you're thinking about that decision, it can be very hard for one of the siblings to not have any input on that. And, obviously they can have input as well if they are, even if they're not appointed as the agent. So, most times, most siblings in a situation like that will talk with the rest of them before making a decision if there's time to have a discussion. So something to consider there. Usually, if there's 3 or more, we would usually put a clause in there that says, if they can't come to a decision, then majority rules in the event that that they're not unanimous, just because at a certain point, there's a need to keep going and making decisions. And that's the biggest risk with appointing multiple people at the same time, is the potential for a deadlock. Or on the other side, the potential for a decision going one way, towards one certain style of care or something like that, and then someone else to, go against that and go the other direction. And you don't want a scenario, if you are in a care home, where you're moving from spot to spot as different children get involved and chat with the care home. Usually that's why we make it either unanimous or a majority of the kids making the decision. Not each of them can make decisions independent of each other, just because it can cause those kinds of issues. When we're talking about a personal directive, it's important to think about when it's for. So obviously, it only comes into effect, or as I was saying earlier, not really obviously, but it only comes into effect when you no longer have the capacity to make decisions for yourself. Usually this is when, and the way, I tend to write these, all of them are a little different, but usually they require a written opinion from a doctor or mental health professional that says you can no longer make decisions for yourself in relation to your medical care, all the things we just discussed. You can also sometimes get have a requirement that there be a second opinion, but that's when it comes into effect. Now, that can happen both short-term and long-term. So, obviously the most common thing, and something that Deepak will touch on, is, slow degenerative diseases. So if you're mentally incapable due to something like, dementia, Alzheimer's, those kinds of things, then once it comes into effect, it's likely in effect permanently. Other times it can come into effect for a much more short period of time. I mean, and more obvious answer is you're incapacitated because you're in a really bad car accident, but 2 days later you're fine. Well, not fine, but you're able to make decisions for yourself, you're recovering, and you're going to be fine. So during that short period of time, you're maybe, I don't know, unconscious, who knows? You're in a scenario where you can't give advice to your medical professionals. You can't make major decisions. And if one does come up, then that's the person who's going to be making decisions for you. Now when you would regain capacity in that scenario, at that point, it would cease to have effect, at least temporarily, until something else happens where you lose capacity down the road. So it's important to note that it's, only while you don't have capacity to make decisions for yourself. And we talked about the broad range of decisions that can be made under a personal directive. And the other part of it is there's a broad range, but the intent behind that is that the decisions are only made where they need to be. So your agent should be consulting you on all decisions, even if you have significantly diminished capacity. They should at least try to get some sort of reaction or some sort of opinion from you where it's possible. Obviously, if you're in a coma, they don't have to sit there and just ask the question just to see if there's a response. If there is, then great. I mean, that's fantastic. But realistically, it's only where practical, but quite often someone with diminished capacity still has the ability to make some decisions or have some input. So that's an important thing to realize. And also someone with the diminished capacity where they can't decide between two nursing homes, or they can't decide between two advanced therapeutic options that are quite detailed, and the sort of risks and benefits of both are a little harder to grasp. They might not have the ability to make that decision, but they can still have the ability to decide who they want to spend their time with, activities they're involved in, what they want to have for lunch. So the really broad discretion given to your agent is really just to allow them the ability to make whatever decisions are necessary, but it's generally under the assumption and sort of the understanding that it'll only be used where absolutely necessary. And if you're able to make decisions for yourself on any front, then you will be able to continue to do so. So that's something to consider there. It ends, obviously, if you regain capacity or if you pass away. At that point, they're no longer able to make decisions for you. That's when your will would take over, dealing with what happens after you passed away. I often get the question of, well, if I don't have a personal directive, my spouse usually gets to make decisions. And it's really a tricky answer, because if you don't have a personal directive, technically speaking, no one is allowed to make these decisions for you. And if you want to make a major decision on behalf of your spouse or someone else, there either has to be a personal directive and a doctor asserting that you're able to act, or you need to apply for guardianship of that person, which is a very lengthy process. You can either do it the cheaper way, which is still a few $10s, and it involves doing a desk application at the courts, takes sort of 6 to 8 months, at least usually. So right now, who knows with COVID, I know everything else is a little slower. But it would be quite a slow process. Or if you needed something on an expedited basis, you're talking up into the thousands, and having a lawyer go in front of a judge and argue your case and all that kind of thing. So it's a very simple document that has a lot of effectiveness when you need it. Obviously, when you don't need it, there's no need. But just like all of the estate planning documents, it's something that when you need it, it is absolutely essential, and it's something that can be tremendously helpful. Having someone who can really step up and speak on your behalf when you're unable to, in the right circumstances, can be, indispensable. So the last thing I want to touch on in terms of your personal directive is something called the Plan Well Guide. And this is something that we are starting to incorporate more and more. And this is where decisions can be made rather than having you make decisions ahead of time in terms of strictly deciding on when you want to be taken off life support, deciding on types of care that you do and don't see. We've started putting a lot more discretion in there. And some people are very, very determined as to what they want and what they don't want, which I understand. But I think if you're very, very set in your ways about exactly what you want and don't want, it might be important to just convey that to your agent who you're appointing, and leave some written instructions with your personal directive that outline that. But generally speaking, what we see is people quite often make sort of snap decisions on this kind of thing, where they're saying, well, I never really liked the idea of being incapacitated for an extended period of time. So let's just say, you take me off life support, pull the plug whenever you get a chance. If I can't make decisions for myself, call it a day. And they're not really making a decision based on good information. So part of that is information that they have right now. Maybe they're not fully aware of the consequences and the scenarios where this could come up. And oftentimes a lawyer is not the person to ask that kind of thing, or to give advice on that kind of thing, because, lawyers are not medical professionals. Even if you do speak with your doctor now, you're also not aware of some additional pieces of information that could be really, really crucial. One is the exact condition that you're in and your likelihood of recovery and all those kinds of things that, could come up in future, because you don't know what ailment you may have in future. And the other thing that's really important is, even if you have a specific ailment right now, or you say, in this specific case where I have X, Y, and Z, we never get into this much detail in a personal directive, but even if you did, in this scenario where I have a certain ailment and I'm in this exact scenario, then, take me off life support or something like that. It's not taking into account advances in medical care. So if there's something that comes up that would allow you to then have better care or better prognosis or better likelihood of recovery, or even if recovery is not an issue in terms of remaining alive, maybe the likelihood of a full recovery or more significant recovery is much greater. So as a result, what we're moving more towards is getting our clients to fill out something called the Plan Well Guide, which goes along with their personal directive. And it has a lot of sort of detailed areas of instruction to your agent, but it's something that your agent would then use. It's not binding, because it just gives more preferences, generally speaking, unless you want to put some very, very specific things in there. But generally speaking, most people use it to give preferences. And that is something that your agent then uses in discussion with your doctors, based on where you're at that given point, where your things seem to be headed, based on all of the information available to your agent, who hopefully you have a lot of faith in, because they're the person you appointed to speak for you, and your doctor, who you're under their care, like it or not. So hopefully there's someone that you can trust as well. The really interesting thing of the Plan Well Guide, last thing I'll touch on this, is just that it's helpful in that it puts different goals of care in their proper context. So for example, I might talk to someone and they might say, well, I want to be kept alive at all costs, for as long as possible, but also I want to have the highest quality of living possible for as long as I'm alive. And those tend to be on opposite ends of the same spectrum. So the Plan Well Guide is actually really helpful in terms of getting people to put their preferences on a spectrum from one side to the other. Obviously there's scenarios where both are achievable, and there's scenarios where neither are achievable. But giving your preference on that spectrum means that when your agent and your doctor are making decisions, they can say, well, we're weighing up, these two alternatives, and they can look at it in the context of that. And it's not just that particular spectrum, there's a few of them, and it really results in some really helpful decision making. So for our clients, we now always send them the Plan Well Guide to fill out. And it's certainly something that can be added to your existing personal directive if you already had it, just to give additional instructions. That's about all I'm going to touch on with regard to the personal directive, because I want to get Deepak to have a chance to speak, because he's got a very interesting outlook on this kind of thing, because he's not from the legal side. He's much more from the care side, and how you might empower. He's going to talk a bit about how you might empower your agent to provide for you to maximize your longevity, your how vibrant you are and how healthy you are later in your life. So I'll do a brief introduction. Deepak is a health performance and longevity coach. He knows what it's like to have a stressful corporate job, raising a family, and trying to do the right things for his health. He suffered from an autoimmune condition and an injured back, both concurrently, and both of those challenges ultimately led to a turning point for him. He ended up overcoming those issues, as well as his lifelong battle with obesity, and he really brings a unique perspective to working with his clients. He's a father of two, and when he's not spending time with his wife and kids, he's usually researching and staying on the forefront of the emerging and cutting-edge health research, specifically in relation to this topic. He's also a speaker, course instructor, and published writer. So at this point, I'll pass you over to Deepak.
Thank you for the introduction, Craig. Appreciate that. So I'm just going to share my screen so everyone can see. All right, I think you guys can all see that. So, so again, thank you all, everyone, for joining us today. I appreciate that. And we're going to talk about something today that essentially nobody knows about, or definitely is not talking about. And that's the gap between the service you get in the hospital versus what you could receive. So I'm mostly going to be focusing here in Alberta, where I live, but it would be very similar across all of Canada and many jurisdictions in the US as well. First off, I want to be very clear that nothing I say today should be construed as medical advice. I'm presenting educational materials for you to consider. And secondly, if you are in distress with any of the topics or any of the conditions that we're going to talk about tonight, please go seek medical attention. So make sure you have a pen and paper ready. Write down your questions, put them in the chat, or sorry, the Q&A box, what have you. Just so you don't want to forget anything that you might come up with. So really quickly, the agenda, I'm really very briefly going to talk about my story, the medical system background. I'll have a bunch of examples. Actually, I've added 2 extras, so that should say 6 examples. But and steps to build your playbook, or what I call the playbook, and then again, plenty of time for Q&A at the end. So here's just a couple companies and media that I've been in the past. And so right into my story here. So again, my name is Deepak Saini. I'm a CPA, or an accountant by profession. I've had my designation for almost 20 years. Been in the corporate world for most of that time, mostly in the oil and gas sector. As Craig alluded to, husband and father of 2 little girls. So make a very long story short, I had some health challenges about 7 years ago. And going through my journey and coming out the other side, I had my aha moment where I realized that my future path was meant to help other people with their health challenges and goals. I'd been overweight my entire life. I was morbidly obese as a young man and at the start of my working career. I battled autoimmunity conditions my entire life. I was always getting sick. And then I ended up injuring my back such that I couldn't even bend over at the waist. I couldn't tie my shoes. Couldn't put on my socks, but the worst was our youngest daughter was a newborn at the time, and I couldn't even pick her up. So I ended up figuring out a way to heal my back, and the welcome byproduct of that was that I released the last 40 pounds of fat that my body was holding on to, and I greatly enhanced my immune system. Eventually, I realized that was that's what I was meant to do for the rest of my life, as I alluded to earlier, just help other people. So I went ahead and did my training, and now I primarily help my clients with their health, performance, and longevity goals. So I'm actively working on being a centenarian, so that's 100 years plus, and I know what it's like, to what's available to us in the medical system, and what is beyond that as well to help me reach my goals. And I think that's why many of you are on here on our call tonight as well. So just really quickly, there's a couple of family photos. So without those 3 ladies, I couldn't do what I do helping others. So let's get into the medical system. So when I went through my health challenges a number of years ago, the traditional medical system here in Alberta did me no favors. I was misdiagnosed, given unnecessary and ineffective treatments, and I wasted 2 years of my health working my way through the system. Eventually, I had to take matters into my own hands, do my own research, find alternatives that worked for me, and that's what healed me. And it's because of this experience that I dug in and found the flaws in the system. But before I get into any more, I want to be perfectly clear. Doctors, nurses, and those others in the medical system, they have the best intentions. They usually got into the profession, because they wanted to help other people. They wanted to make a difference, and they're worthy of our recognition, especially nowadays. However, for a variety of reasons, which I won't delve into today unless somebody really wants to ask in the Q&A, but those reasons including the influence of big pharma, poor policy, etc., the standard of care in Alberta and many other jurisdictions is limited and does not include treatment modalities that are the standard of practice in other jurisdictions in the world. Many of these modalities are proven with a ton of research around them. Many of them have been around for a very long time. Some of them have been around for thousands of years. Many are free or very low cost. Many doctors won't know about these because they weren't taught about them. Medical school curriculum is heavily influenced, unfortunately, and most continuing education for health professionals is put on by industry and is not independent. So when I was an accountant, I could go to XYZ's company's webinar or the luncheon they put on to hear about their new service or et cetera, and I could get professional development credits for doing something like that. It's the exact same thing. Many doctors over a certain age won't even know the newest science of the last 10, 15, or 20 years. And GPs or general practitioners, they need to know a little about a lot of things. And specialists, they need to have a lot of knowledge, and they go very, very deep and not very wide. So there's a big gap there. The medical system kind of tends to work in silos and not look at a person's whole holistic health perspective. Many doctors still believe that cholesterol causes heart disease. I even had I'll call it an old school doctor who told me that they should put statins in the drinking water. That's just some of the mentality that we face. It takes an average of 15 to 20 years for a proven, well-researched, peer-reviewed study to become the standard of practice for the frontline health worker. For drugs, it takes an average of 12 years to go from the lab for patients to see it. So even if your doctor or specialist knows about this research, knows about these new modalities, even if they believe in the efficacy of it, if it is not classified as the standard of care, they cannot tell you about it. They will get into trouble. They may be sanctioned. They risk their livelihood, their financial well-being. And we're certainly seeing a lot of that nowadays as well. Now here's a US stat, but doctors spend $210 billion a year on procedures that aren't based on patient care, but on fear of liability. $210 billion that have nothing to do with the patient's health. There are many things doctors will or wouldn't do with their own families that they won't or can't tell you about. I have a family member in the medical field, and they can't say this publicly, of course, but they privately told me about the misinformation they see. But again, they only tell me privately because they fear losing their license and a very comfortable income. So it is up to you to know what is available to you, what to ask for, how to access these resources, and how best to provide world-class, scientifically proven treatments and modalities for yourself and your family. So let me give a first example. A couple years ago, my nephew unfortunately had 4 TBIs, or traumatic brain injuries, occur in a 4-month period. So basically he got 4 concussions in 4 months. Dramatically affected his personality. Luckily, the old notion of sit in a dark room for a period of time, luckily that's dead. The advice he did get was to try and sleep better, stay off devices or limit their use, and do some breath work or mindfulness. So those are all great and a great first step, but there was so much more that could have been done, especially around nutrition, supplementation, and auditory stimulus. At the time, I wish his parents, knew the proper steps to take, or had reached out to me at the time. But luckily, he seems to be fully recovered. Here's another example. So many people who have heart disease or even erectile dysfunction will be familiar with taking nitroglycerin or nitro, which is a vasodilator, meaning it opens up the blood vessels to alleviate symptoms. Now, if you're having a heart attack, hey, that's great stuff to have around. You want that around. But you won't be told about dietary foods that are rich in nitrates and nitrites that convert into nitric oxide and also dilate blood vessels and lower blood pressure as well. So you could incorporate these foods into your diets to help if you have these type of conditions. And even if you were told about these food sources, you certainly wouldn't be told about breathing techniques to boost your endogenous nitric oxide production 15-fold, to not only help vasodilate the blood vessels, but also act as your own body's defense against pathogens of all sorts. So here you can see the chemical molecule for nitroglycerin and NO. So it's very similar. It's basically 3 times. It's just giving you three times of NO. So another example here. So I have Alzheimer's in my family. I had an aunt unfortunately pass away earlier this year because of Alzheimer's. I have tested myself and I have the Alzheimer's gene. So that makes me slightly more likely to develop it. So if you or a loved one are starting to show early signs of dementia or Alzheimer's, do you know how to battle it, and do you even know how to reverse it? There are at least 10 different modalities to battling a condition like Alzheimer's, but you'd be hard pressed to get this information from the medical system. And even if you did all of those, researching them all on your own, do you even know where to source all those treatments? So let me take a step back for a second here and be perfectly clear. Prevention is always your best course of action. Being proactive than reactive will always be in your best interest and the best investment in yourself. Diseases, conditions, ailments, they don't just come and afflict us one day. They're all the tiny little paper cuts that build up over time and finally catch up to us. So being proactive is the single best thing you can do for you and your family's health. Optimizing lifestyle choices is the #1 thing I work on with my clients for their health, performance, and longevity. Even if there should be a tragic accident, like a car accident, while you can't always prepare for that, there's certainly knowledge to be equipped with to, optimize your recovery. So let's talk about the mouth for a second. I'm guessing we've all been to the dentist before, and we've probably taken our kids there as well. We've all had them put that fluoride paste, on our teeth, and we've all been recommended to use, fluoride toothpaste. We've all been told that we need fluoride to kill the bad bacteria in our mouth. Now, this is true. It does kill the bad bacteria, but it kills all bacteria, all microorganisms in your mouth. So, I'm sure we've all heard about the gut microbiome, right? It's been kind of big news, probably 10 years now, and everyone's pretty familiar with that. So everyone kind of knows about that. You probably even know that there's a skin microbiome, sort of the bacteria that sort of live on your skin that keeps us healthy and or could harm us. But you've probably never heard that there's also a mouth microbiome. So when you use fluoride, mouthwash, etc., you're killing everything in your mouth, all the mouth microbiome, including the bad and the good. So not only does that affect your mouth microbiome, that also affects your gut microbiome as well, because you absorb so much, anything you put in your mouth, you basically absorb into your system. So, I think we all know now that, the gut microbiome is so foundational to our overall health and having a healthy gut microbiome. But using, products in your mouth affects your gut microbiome, not only destroys the microbiome in your mouth, but affects your gut microbiome, thus impacting your health as well. So not to mention that fluoride in large quantities is a known neurotoxin as well. So even if they knew, dentists cannot tell you about how to have your child breathe properly through their nose rather than through their mouth. Breathing through the nose when you're growing, your face is still developing, allows you to have proper jaw and teeth alignment. So it allows adequate space in the mouth for the teeth to come in properly, and it lessens the likelihood of needing braces or any other treatments. So, there are alternatives to much of what we believe when it comes to dentistry, and one just needs to know and to educate themselves. So one service that I offer to my masterclass clients beyond optimizing lifestyle is to help them build this playbook that we're gonna talk about here, so that they know what to do, what to ask their doctors, what resources are available, where to source the resources for any number of potential afflictions that may occur. So for my clients, this is about knowledge and empowering themselves to be prepared for the worst. You can think of this as another form of an insurance policy for you and your family's health. Typically, you would add this playbook and keep it alongside with your personal directive, as well as discuss it and keep a copy, with all your other documents and with your agent, as Craig discussed earlier. To be clear, it's a separate document. It's not legally binding, but it needs to be available for review if something should happen to you, or a family member. So again, this is a service that I offer to my personal masterclass clients that I'm now offering in partnership with Craig in The Last Word. My masterclass is called Build Your Personal Blue Zone. So let me very briefly describe what the process would look like. So first, we'd have a nice short little 15-20 minute no obligation call to discuss the issues that you may already be facing, the things you're concerned about, the things that are keeping you up at night, and the things that are might be in your family history. Next, if during that call or afterwards you decide you want to be absolutely prepared to protect your family's health, I'll send a health history form, an intake form, if you will, for you to fill out. And then from there, we'll work together to build out this playbook that is customized to you and your family's individual situation. So this is the first time I'm offering this as a standalone service to my masterclass, from my masterclass clients. So I'll be offering a 10% discount to today's participants in today's presentation or any of the Last Word clients. Of course, there'll be many action steps that'll be common for everyone, but the nuance can sometimes make all the difference. And the best part is that as new treatments and modalities become available, or as a standard of care in your jurisdiction changes, you'll receive updates so that you can incorporate them into your plan. And that's all part of the cost upfront. So let me give you another example here of a major change that's happened recently in Alberta. So most of us are probably familiar with ozone or O3, and here's a description of what the molecule looks like. You probably know that it's harmful for your lungs if you breathe it in. You probably also know that it's used in medical settings for disinfecting equipment and surfaces. But do you know about ozone therapy and which can have the following benefits? Inactivating bacteria, viruses, fungi, parasites, yeast, protozoa, stimulating the immune system to speed up healing, improving circulation by cleaning the arteries and veins, purifying blood and the lymph, normalizing hormone and enzyme production, having anti-inflammatory properties, reducing pain, stopping bleeding, preventing shock, limiting stroke damage, etc. These all sound pretty good, right? Especially for something, this thing that we've been all dealing with for the last 8 or 9 months. So ozone therapy is not the standard of care here in Alberta. After researching and learning about it in other jurisdictions, 2 years ago, I started looking for private clinics that might offer it. I couldn't find any in Alberta. So recently my interest was piqued again, so I started looking into it, and I was pleasantly surprised that there are now a few private clinics that offer variations of ozone therapy. So a great start. At the same time, I found a company that has found a way to capsulize ozonides, which is what ozone breaks down into once it enters your bloodstream. So I'm just beginning to experiment with that product now. So basically, it's a capsule that releases ozone into your system. And finally, less than 2 weeks ago, I came across a company right here in Calgary that's on the verge of able to start testing nebulized ozone. So essentially what that means, if you're not familiar with that term, is you can put on a typical oxygen mask and breathe in ozone water mist. And it won't be harmful to your lungs, and you can kill pathogens in the nasal cavity. So more details to come on that. It's something I'm following very closely. So it all sounds, pretty interesting, but this is just one example of many. Some of the gap between the gold standard of treatment versus the standard of care that we have here in Alberta, or your jurisdiction. That's and sometimes this gap is being filled by private clinics and companies, but there's also so much you can do on your own for free or very little cost. You just need to, educate yourself. So let's quickly talk about one more example here. So cancer, definitely the trickiest one to discuss. So, while there's some really interesting drug treatment options being developed and gene therapies and that sort of thing, they're a few years away. So currently the options almost always entail one of the three options: surgery, chemo, or radiation, and they all each have their own drawbacks. Now, getting a diagnosis is a very difficult conversation to have for sure, but do you know the questions you should be asking your oncologist? They will more than likely not discuss nutrition or lifestyle choices, nor alternative treatments. Now, don't get me wrong, I'm not suggesting that you don't follow their recommendations, but there are things you can do alongside on your own that they won't or can't tell you about because either it's not the standard of care or they don't even know themselves. So do you know how to source these alternative treatments, or what steps you can take personally? Again, private clinics are filling in some of the gaps here in Alberta. So again, one final thought. Again, prevention is always your best tactic, but if you should be suffering from one of the ailments discussed or others, seek medical attention, but use other modalities, alongside as well. So just quickly, just some contact information if you want to learn more about what I do with my clients, or about this playbook to add to your will and estate planning right here. And then again, we promised a ton of time for Q&A, so I'm just going to stop the screen share and let's get on to the Q&A. So again, we have a bit of a small group here today, a little bit less than expected. So I'm actually going to unmute everyone so you can just ask your questions. So everyone is, oh wait. All right, what is going on here? All right, anyone, if you have a question, I try and figure out the technical side here. I don't know, it's not working for me. But put in the Q&A while I try and figure this out. Sorry everyone. Ula, you are unmuted, so if you have a question.
I do have a question for Craig.
Yes.
For an EPOA, the individual needs to have independent legal advice. For a PD, is it the same? Should they have independent legal advice, or are the forms that they get from the government that they fill out just as good?
So it can vary a little bit. So when you're saying independent legal advice, you don't actually need a lawyer to sign a power of attorney with you. It's just advisable. I mean, obviously I'm biased in terms of what's advisable and what's not, but generally speaking, there's things that you might not be aware of, and having someone to walk you through it and make sure everything's done properly, set up properly, so it'll be valid, so that there's no unintended consequences, that kind of thing is important. With the personal directive, it's much the same thing. There's a little more, because it's not focused on the financial side, there's a bit more where we're providing more discretion to the people that you're naming. So as long as you can properly appoint them using the government provided documents, my feelings tend to be more along the lines of, it's the one out of your will, power of attorney, and personal directive. The personal directive is the one that, if you're going to do one yourself, or with a sort of template, that's the better one to do that way, as long as you make sure it's signed properly and it's legally effective, and that you're appointing the right person.
Okay, thank you.
Does that kind of answer your question?
It does. Yep, thank you.
Okay, perfect. Yeah.
All right, so we got a question. I don't know why I can't unmute everyone else, but Berto did ask a question here. So how many ozone treatments do you need depending on the treatment? What is the general cost per treatment? So that would really vary. Oh, Berto, now you're unmuted. I don't know what's going on here, but
just Lori's.
Yeah. I'll keep playing with that after. So it's really going to depend what you're using it for. Is it from a preventative measure, or are you actually battling some ailment? So let me maybe just take a step back and say some of the different ways you can do ozone. So probably the gold standard from a preventative measure is what's called 10 pass. So it's basically like a dialysis. So you'll be hooked up. Blood will take out, circulate through. Ozone will be into like a not a centrifuge, but like a tank kind of thing, and ozone will be introduced into your bloodstream, and they'll circulate back in, and then they'll do that 10 times. So after 10 passes, you almost nearly all your blood has had ozone put to it, and something like that is rather expensive. You're probably in the, again, nobody's doing that in Alberta at all. You'd have to go probably to the States or overseas to get that done at the moment. But you're looking like probably a couple $1,000s, but you'd only do that, at most once a quarter, like once a year type of thing. Another thing could be just ozone IV, which is basically just intravenously, like you would do like a vitamin IV or something like that. So there are some clinics in Calgary and Alberta, probably across Canada, that do that, and you're looking, you're kind of in the IV range, again, depending on what else might be part of the cocktail, or probably going 150 to 250, somewhere in that range. We did have a couple of naturopaths who were supposed to be on the call. They could have answered in, but in about that range. If you have some injury, like a burn or something, the other way to do ozone is to where basically the limb or the foot or what have you is basically bagged, so it's wrapped around, and then ozone, the gas itself. So ozone breathing in is, again, poisonous to your lungs, or damaging to your lungs, I should say, but to the rest of your skin, it's not. So then ozone will seep in through your skin into that area. So a lot of times you'll see people like their foot or their arm or something wrapped in a bag. And again, I'm not exactly sure, but you're probably looking at a couple hundreds of dollars in that sense. This is probably going a little bit further than your question, Berto. Feel free to chime in if you want me to clarify anything, but this new pill that I've found that encapsulates the ozone bypasses the stomach in sort of a time release fashion. So the ozone gets released out of the carrier oil once it's already in the intestines, and that's relatively really inexpensive. Again, just experimenting with it now. I can't really recommend it at this point, but we're talking like $50 a month for these capsules type of thing. So that was a very, very high level. It really depends on what you're looking at it for. But hopefully that answers the question. If you want me to clarify any further, please do. Please ask away. Let me just make sure I can. Now Burrow got muted again. All right, let's just use the Q&A box, everyone. Oh, now Burrow, you're unmuted now. I don't know what is going on. Technical difficulties here, so. I found it. I'll just, while we're waiting for a Q&A question to come in, I just to Craig, you were talking about this new, I forget what the term you call this new plan.
Manual guide. Yeah.
Yeah. It's like, that's relatively new. I think when we first were having this discussion on doing this event, that I think wasn't even around. So it's very complimentary to kind of what I do or what I'm proposing with the health plan for sure. Yeah.
Yeah, and it's again that sort of allowing room for advances in medical care, more new treatments and things like that, especially. It's really helpful for that.
I know we got some more questions here. I threw a bunch of crazy stuff at you very quickly there. Somebody must have a question on that, on any of those things. Prevention is always the best. How about you, Craig? You have any questions? You haven't heard my presentation before, so some of that must have been new for you as well.
No, yeah. Well, I mean, it was very interesting. I always find, do you find that when you're doing research and stuff like that, like I've heard of, I kind of suspect I've heard when people talk about sort of the more cutting edge of things, it's more like, do you find that you end up searching through things on like PubMed and things like that? Is that, or where do you end up sort of finding this like cutting edge info?
Sure, a lot variety of sources. So PubMed or other sort of PubMed for sure. Other I subscribe to some newsletters and stuff that sort of aggregate cutting research from a variety of sources. That's a little bit easier and more cost effective than subscribing to like a bunch of journals and that sort of thing. Plus, I do a ton of reading as well. So I kind of bit of a meta researcher, if you will. So a bit of research on research. So if somebody writes a book and has 3,000 sources for their point of view, then you can go through that.
Well,
and
for sure.
Sort of,
I mean,
sort of
it's a professional, it's a
for you.
full-time job just to find that information on one tiny specific topic, right? So
For
you do
sure.
need to, for sure.
Yeah, so that's kind of how I go about it. So we have another question here. Would the plan well guide be better than goals of care? So I think that's a question for you there.
That's a very good question. So goals of care tend to be more specifically set out and more specific to when, I guess, to your current medical state. So generally speaking, if you are perfectly healthy and you fill out your goals of care now, chances are a lot of what you put in there was really outlining, not saying, okay, well, end things early, or I don't want any specific types of care, because you're sort of putting things in place based on your current medical position, right? Goals of care tend to change significantly. Say you were diagnosed with terminal cancer. You would then usually change your goals of care accordingly to match what you're currently dealing with. So goals of care are something that need to get redone quite frequently. And they're something that you do with your doctor. So kind of similar to the, you could definitely do the plan well guide with a doctor as well. But the goals of care are quite literally saying, here's what I want on file with Alberta Health, as saying, this is what you can and can't do very, very specifically. And it's something that, tends to be specific to your current scenario. Whereas the plan well guide is much more of overarching principles on which your agent is going to make decisions in concert with your doctor that are applicable based on where you're at now, and also where you're at if you're diagnosed with something much more serious. If your scenario changes, they're still going to make decisions based on those general principles that you put in there and your general preferences. So there can be, as you can see, like they can definitely overlap, but quite often there's a pretty big difference. And the plan well guide is a lot easier and a lot more applicable to put in place if you have no significant medical concerns right now, because it's applicable across these various different timelines of your life. Did that answer the question? Hopefully.
Thank you. Yeah.
Yeah, you're welcome.
How about you, Berto? Any other additional questions? Or I think everybody's unmuted now.
No, not really. There's a lot to digest there.
For sure. I think probably everyone's probably a little bit more familiar with the stuff Craig talked about, and I threw a lot of stuff out at everyone for sure as well. So definitely you could always follow up later if you have some questions later on. So
well, this playbook, just real quick, this playbook,
yes.
Is that something that you offer as a standalone? I may have missed that.
Yes, yeah. For the first time, for people on this call or clients,
it's 10% off.
10% off now. People on this call and Craig's client, from what this is the first time I'm offering as a standalone. It's always only been bundled in my whole masterclass program, but this is just gonna, we're pulling this piece out as a standalone for sure. Yeah.
Okay. Did you mention the price? Sorry,
I did not mention the price. If we can chat offline on that if you like, Berto.
Right. Okay.
All right. Well, if there aren't any other questions, I guess we'll probably wrap things up, I think we could probably just we could probably send a follow-up email just to the presentation, just with all of our contact information in case anyone needs it. And it'll go out obviously with a video in case you want to share it with anyone or look at anything again later on. I'll leave it up to you, Deepak.
Yeah, I'll take care of that. Yeah, we will send the video out here by the end of the week to everyone on the call and everyone who registered. So even if you're seeing this, if you weren't able to make the live call, you'll still get access to this. And I'd just like to thank everyone for coming on. I know there was a lot, at least if you lived in Alberta, a lot going on today in the world. So that might have hampered you able to view it, what have you. But gratitude to everyone who came on. Thank you to my friend Craig here for being my co-presenter on this very important topic. I think it's even more important. It's always important, but definitely some challenging times we're in right now. And I think taking care of our personal health and our family's health is even more so important now, and something we really need to look into. So again, thank you everyone for attending, and we'll be signing out.
Thank you.
Thank you. Take care.
Thank you.